Good afternoon, everybody. It's Friday, May 15th. Happy Friday, and I'm doing the weekly COVID update. Again, our website is falmouthmass.us. The health department's email is health@falmouthma.gov, and our phone number at the health department is 508-495-7485. That's a general inbox, and we'll do the best we can to get back to you as quickly as we can. So that's a little bit, and this is our weekly update. As of today, is 155 cases since the first in early March. Over 80% of those cases have recovered and are out of isolation. As with the rest of Barnstable County, most cases are related to congregate living, such as residents and staff of senior living type of arrangements. I had a call yesterday with Barnstable County, and that's what we're seeing pretty much all over the Cape, is that the newer cases that we're having more recently are related to nursing homes, assisted living, and things of that nature. And we'll go into that in some detail a little bit in a further slide. So we continue to do the contact tracing on each case in isolation, and that doesn't change and won't change. It's actually one of the keys of trying to get back to some sense of normal is very aggressive contact tracing. We remain about 14% of all cases in Barnstable County. Again, 23% earlier in April, but we've been remaining about 14, and 14 is about what is expected. Our weekly case trend, you can see a little uptick. It's still relatively the same curve, but the uptick is, again, primarily to incidences at a nursing home, and so we'll cover that in a sec. Here's our case trend. We're still sort of in the same sort of tangent that we were off, in the same sort of slow sort of growth. Most of the very few cases we're getting are actually cases of not necessarily knowing where they came from. I think this week every case I saw had an answer. So there were assisted living staff, that type of thing, and so that's a good sign that there isn't very much community spread occurring at this time. Again, we do have asymptomatic, and we're not 100%. We're not capturing 100% of all sick people due to the asymptomatic, but that's at least what the trend's been. It's been the trend for a couple of weeks now. This is from the state's dashboard. Don't get too worked about the total number of new cases, because the more you test, the more you're going to find. I'll tell you the best data to look for in a second, but that's our data. Our hospitalization rate has been dropping because we're catching more and more asymptomatic through our increased testing in hot spots such as Chelsea and Brockton and some of these other cities that we've had some issues with, that the state's had. There's been 167 new deaths and 5,482 total deaths. There's been almost 500,000 tests performed with 82,000 positive. Looking at, this is every week on that dashboard, there's a by town, or by jurisdiction, by town sort of number of cases. So I pulled that off that and showed you what Falmouth has got 150 at the time. That was Tuesday. With a case rate of 479, almost 480 per 100,000. The state's average is 1,155. So we're about 41%, or 41% of the total number. Probably should have stated that a little bit better, but we're less than half of the state's rate. And that's going to be important when I start talking a little bit about the state's plans for reopening in further slides. Again, COVID testing, there's the testing. We want to continue to have the testing increase. The state wants the overall percent of tests that are coming back positive to be less than 10%. We're hovering around that 11, 12, 13, 14% for the past, roughly the past week or so. So we need to get that number down a little bit, and that's one of the metrics that the state's going to be using. Growth by county, you can see that we're, with the big red arrow, is Barnstable County with 1,119 cases. We're sort of at a very flat number there, very flat curve. We're doing well compared to some of our other counties, like Plymouth has got 6,774, and Bristol's over 5,000, with when you get up to Suffolk County and Middlesex County being in the mid-teens. And so that's, we've been sort of on that same trajectory, for quite a while now. Again, this hasn't changed much. We're still in the moderate sort of, compared to other low to moderate infection rate compared to the rest of the state. This is the one I'd like to, when you're looking at this dashboard, again, at 4 o'clock, roughly between 4 and 5 o'clock each day. If you go to the state's COVID website, they'll have this dashboard. And the number, the most important number, and I conferred this with the county, with Sean O'Brien over at the county, he mentioned the same thing, is the hospitalization rate is the best indicator because that number is a relatively fixed number from the beginning of the pandemic. So the people that are going to go to the hospital, the real sick people are going to go to the hospital, and that number is not relating on the number of tests and sort of the fluctuations that you see it. So you can see that we've had a nice downward trend for almost probably 3 weeks or so at least, where we're starting to see less hospitalizations. And you see that the most recent one on the 13th was down 242 hospitalizations. So that's a good sign. We want to see that number continue to trend downward. So when you look every day, that's the number one you want. You want to see a minus in that category. Let's go talk about nursing homes a little bit. Okay, this is on the left, you'll see that the COVID cases in long-term care facilities. So there's been 340 long-term care facilities that had at least 2 cases. There's been 3,338 deaths, or 61% of all fatalities have been from long-term care. 21% of all the testing has been at long-term care, which is a number we need to really do diligent testing and continue and focus on these facilities because you need a lot of testing. And so that we can segregate those that are ill, and especially employees that are ill, because employees are typically difficult because they're going to go to multiple rooms. So you could keep residents in their rooms, but someone who's changing the bedding or cleaning or things of that nature, or just tending to the health of the resident is going into multiple rooms. You can also see by nursing home, any nursing home with 2 or more cases. So all I did was go to the state's website and pull 3 of them that are in Falmouth. And you can see that we have a couple that are less than 10, and they only report based on less than 10, 10 to 30, or 30 plus. We have one that's between 10 and 30, and 2 that are less than 10. And you can check that, that's updated, I think, weekly as well. Maybe that's actually daily or routinely. So you can check that, again, at the COVID website, you can get the same data. And so the hospitalizations, it's not going to be a surprise that from 5/12 around the last couple of days that a lot of this has happened, that our hospitalizations at Falmouth Hospital have gone up. So they went down and then they've gone back up, and you can see where it's gone up, basically 11 in the span of a couple of days, is because when it hits a long-term care facility, hospitalization is a relatively common thing, unfortunately. So that number is fluxing because of that. And again, just to say that the fluctuation is generally happening because of these long-term care, and we're not seeing a lot of community spread at this time. Barnstable County testing is the same, the slide I've had on there for several weeks. Continues at the Cape Cod Community College. It's set up as a drive-through hours of Monday through Saturday, 9 to 5, and your physician will determine the need to test. Okay, that's for PCR testing, that's for swab testing, and checking for the virus itself. It's not antibody testing. Which we're doing some research now on antibody testing, and the FDA is working hard to see that. But when you hear antibody testing, I just want people to know that antibody testing is generally to try to see if you've got the presence of antibodies, which would tell you that you have a past infection. But I've heard that some of the newer ones are getting good, that they can actually tell with some certainty whether you have an active one as well. But so I've been doing some research. Actually, when I leave here, I'm going to go to a site today to see how they're doing it. Reopening. So there's been a lot of talk on the 18th that the reopening committee should be reporting back to Governor Baker. And you may have seen this chart out over the last several days. And it's got a multi-pronged approach to say that, okay, currently we're in the red at the stay at home. At some point, maybe as early as the 18th, we may start up phase 1. We don't know what these industries are. So when he mentions industries, I don't have any more information about what these industries are. I could guess that I think perhaps maybe restaurants might be phase 2, whereas more outdoor things might be phase 1. Not 100% sure. We'll see what happens when it comes down from the governor. So we have phase 1, and we have limited industries resume operations with severe restrictions. And then we have additional industries in phase 2 with restrictions and capacity limits. Then you get to phase 3 with additional industries with some guidance, and then you go with the new normal in phase 4. Now, the main thing is the data that's coming in and on those, when I talk to you about looking at the hospitalization rates and the case rates, you can kind of get a sense that what direction we might be heading in with that, and the state's looking at that as well. So if the numbers don't look good and things are going back to a bad state, then we have to make adjustments, and we might have to go from a phase 3 back to a phase 2. And if you're considered a phase 3 business, you would have to close or some sort of thing, probably, and then when we go back to a phase 2. So much more detail is going to come next week, early next week. I don't have all the information, and then what we plan on at the town is to take that information and disseminate it and follow what the state's guidance is on this. But we need to keep the thresholds down, so we need to keep the diligence that we've had. And I have to say thanks to everybody in town, because we've done a fabulous job. We did start a little hot the first week or two in April, but we have really done a bang-up job of keeping our counts down amongst sort of what I'd say, the shoppers and the random public that's out there, and we've done a good job. I mean, we're struggling with a nursing home, and so was in 300 other ones, and that's been happening everywhere. But we've really done, as a town, a bang-up job, and thanks for that. Some of the things that the state's going to be working on this week is industry-specific guidelines, about social distancing guidelines, and each workplace guideline, specific safety protocols and best practices for the businesses the industry that they're allowing to open. They're going to provide easy-to-digest public-facing community across, easily to digest information, and communicating that all out. So the expectations are going to be sent out next week. Some of the things they're going to be tackling is social distancing, hygiene protocols, staffing and operations, cleaning and disinfecting, and how that's going to happen. And for example, my background happens to be food safety, so I've been working with the restaurant and reopening sort of guidance, focusing in on these. And so if the state gives us very little information, the county health agents have been working together to sort of give some more guidance, because I think the restaurants would want to know how to do things right. And I want to be able to provide them with the best information, or we want to, as health agents, be able to provide you with the best information. So there's a lot going on behind the scenes. There's lots of meetings going on, businesses and officials and everything trying to work together to get the best way to get the ball rolling with it. When the state decides to let us know when it's safe. So again, like social distancing, how we're going to do it in dining rooms, and how we do it at hair salons, and how you do it at the beach, and all that stuff is being worked on now. Okay, hygiene and how staff needs to behave and make sure that they don't come in ill. Return to work plan. What does it mean? How can you go back to work? When can you go back to work? Right. So all that stuff is going to be worked on, and all that guidance is going to be given. And the state's going to give us what they give us, and if it needs to be more information, it's more information. I personally don't want to necessarily do things out of order. I think we should do things as conjunction as communities. Instead of Falmouth deciding to do one thing and another town doing the other. So my intent is to try to do things in unison according to the state guidelines. Falmouth-specific industries, there's been a lot of talk this week. Town management and the beach committee and all that, talking about, occupancy, staffing, how to take payments at beaches. A lot on restaurants and retail, what's the occupancy going to be? We don't know yet from the state. Utilizing outdoor seating as a way of increasing, or at least handling occupancy changes. Being outside, having more outdoor seating, and some places are set up for it, some places aren't, and some restaurants have been looking to increase that way, at least have better social distancing that way. We're waiting for state on personal care, hair salons like nail salons, things of that nature. Hotels and motels, I don't know what the occupancy is going to be or the standards are on that. Short-term rentals is another big one. Currently, the non-essential guidance is no less than 31 days. We have a huge short-term rental, and I don't know what the state's going to do right now with short-term rentals. We do have a group of health agents working on guidance on that, if it, based on different directions the state may go. Another one is campgrounds, short-term versus seasonal residents. We do have people that stay in winter rentals and go to campgrounds and want to stay in a campground. Well, that's over 31 days. So the way I interpret that now is that's their living arrangement that's not considered a short-term. But that has to be dealt with. I don't know if the state's going to allow a 14-day stay at a campground. or at a hotel over a week or not. So I don't know when, I'm sure they will at some point, but it's going to depend on where it is and what it is in the phase, and which phase it is. So a lot of that is all going to be next week. A lot of that's going to make a lot of clarity next week. I think that when I do this presentation next week, it's going to be a little bit longer. It'll give you the numbers like I normally do, but there'll be a lot of focus in on the opening procedures. So if you see in those pictures, the one with the mannequins, I saw that on TV last night with some of the open tables. They had mannequins there to kind of give it some ambiance. So I thought that was, if you saw that on TV, that was pretty funny. So that's where we're at on that. So as a recap, Falmouth's holding steady in general, but there is an increase in the long-term care cases. That's sad. State's doing better per hospitalization rate. The state's to announce reopening plan early next week, and the town's we're working really hard on the implementation of that plan as it comes down. So we're sort of getting frameworks in now and going from there. So as it happens, just to let you know how it happened here in Falmouth is, if Governor Baker said that a certain industry can open with these guidance, I would be, as quickly as possible, sending that guidance out to as many people as I could through email. It's a little bit easier when it's an industry that I regulate, such as a restaurant, but a little bit tougher with because I just don't have contacts. But we'll do the best we can to try to get that information out, post it on our website, email, anything we can to let it know, and I'm sure you'll get it through the news as well. And so a lot should be starting to happen next week as far as that's concerned, and hopefully we continue the trajectory, a good trajectory once we do start opening. So that's all I have for this week, and again, if you need to get a hold of us, you know how to get a hold of us through email or phone, and thank you. See you next week.